So continuing on to build off of what we looked at in class during lecture, begin talking about some of the different pathologies with infections. So again, common things you could possibly encounter. Some of the different conditions here we're looking at infection-wise. You have viral gastroenteritis, food poisoning, traveler's diarrhea. They all cause similar things. Obviously, depending upon the type of infection and everything, you could have some variation there, but just kind of make note here of what the different causes are. So viral gastroenteritis is usually going to be caused by consuming some food infected with a virus. Food poisoning is typically caused by a bacteria. Different types of foodborne bacteria, the two more common types being the Staphylococcus bacteria and E. coli. Again, the potential there is for there to be further damage to other organs depending on the bacteria that's consumed. And then traveler's diarrhea is something commonly encountered, particularly if you have a team that travels to other parts of the world. Different types of food and water contaminate it with bacteria and viruses. So the thing here to kind of make note of when you're kind of constructing your signs and symptoms chart, kind of note the specific as it relates to treatments and the type of medications that could possibly use to control the symptoms with these conditions. Looking now particularly at disorders that affect the upper gastrointestinal tract. So remember when we discussed this in lecture, we kind of talked anatomically about the difference between the upper and the lower gastrointestinal system. So you could, again, kind of narrow down some of your causes just kind of based on general location of things. So you have here dyspepsia and gastroesophageal reflux. And these can both be related to one another. But basically, when you talk dyspepsia, which is basically heartburn, when you're looking at your terminology, it's an uncomfortable burning sensation under the sternum that you get, and various things could cause this. Certain medications could cause it, drugs could cause it, alcohol, caffeine. Women who are pregnant do tend to suffer a lot of dyspepsia or indigestion. So you look at what kind of causes that. Gastroesophageal reflux could actually produce some of the symptoms related to that. So they're two conditions that, while we look at them separately, are kind of related to one another. And you kind of see what goes on with gastroesophageal reflux. If you look at the pictures on the slide, there's the lower esophageal sphincter, which is basically like a little muscle that kind of closes off the stomach. So when that doesn't function appropriately, the stomach acid kind of goes up into the esophagus and produces a lot of these symptoms. So typically, again, gastroesophageal reflux is going to be caused by dysfunction with that. Exercise can actually contribute to that. So exercise, particularly with a lot of vertical impact force, so a lot of jumping and things like that, obviously because of what that does mechanically. And stress is a big producer of GI disorders in general, but reflux can cause a lot of problems with that, primarily because when someone is stressed, their body produces increased gastric secretions, so that causes an increase in stomach acid, which could then contribute to that. So, again, for the most part, a benign condition, you just have to be aware of. It gets the matter a lot of times of finding the trigger for the individual. It could be a diet change that they have to go through, or even possibly, looking at just like general habits, what they're doing to kind of control this. So again, make note of the, over-the-counter medications, prescription medications that your textbook talks about as far as the treatment for these conditions. So here you have a hiatal hernia, another upper GI disorder. So what basically happens here is a hernia itself is any type of abnormal protrusion. You probably have heard of there are various hernias that could occur in the body anywhere around the abdominal region. What happens with a hiatal hernia is the proximal stomach, or the upper region of the stomach, actually protrudes through. You can kind of see it in the picture. the hiatal hernia kind of protruding through the diaphragm, this could actually be something that also could possibly become a problem with reflux. So people who have reflux sometimes may have hiatal hernias, because you could kind of see anatomically what happens with the normal versus the person that has the hiatal hernia. So you look at the top picture, you kind of see the lower esophageal sphincter, you can see the esophagus, so you have a cross section of the stomach there, and you can see in the bottom picture where the actually part of the stomach kind of pushes through where the diaphragm is. So remember, the diaphragm's that muscle that helps us with breathing, and you can kind of see anatomically what happens with the stomach with that. So again, they could cause a lot of problems with the lower esophageal sphincter, and some other gastrointestinal symptoms could accompany that as well. So peptic ulcers, so these are ulcers that form in the stomach. So essentially what happens is the gastric juices, which are very strong, break down the mucosal layers of the stomach. So ideally, the stomach's covered with a mucosal lining that for the most part can protect itself. Now the other sort of culprit with this, that they actually firmly believe is the culprit in most cases, is actually a chronic infection with a bacteria. There's a bacteria called the Helicobacter pylori that is basically a chronic infection. So people that naturally have this bacteria in their stomach predisposes them to to developing a peptic ulcer, whereas you see in the picture that layer of the stomach, the mucosal layer of the stomach, kind of breaks down. Again, they do also attribute the development of peptic ulcers to other things. People who take non-steroidal anti-inflammatory drugs, alcohol, nicotine. Again, stress is obviously also something many times attributed to that, but really one of the big causes of this is the presence of that bacteria. So it's always something that they'll also look for in someone who they might suggest has this condition. And then gastritis is an inflammatory condition of the mucosal layer of the upper gastrointestinal system. Again, key is here being aware of what denotes the upper gastrointestinal system versus the lower. So make sure that you kind of have that down anatomically. And it can be caused by a variety of things. There's many different forms of gastritis. So you have basic inflammation, medications could do this, bacterial infection, even autoimmune conditions can cause this to happen. You basically have a couple different categories. So you can have acute or chronic, and erosive or non-erosive. Okay, so there's a difference between all of those. So usually, for instance, with an acute erosive gastritis, usually that's caused by some type of severe chronic illness. Many times a chronic erosive is caused by long-term use of NSAIDs, alcohol abuse, things like that. And then you have your non-erosive. So really, acute and chronic just kind of looks at the initial presentation. Erosive, non-erosive looks at, is there actual physical damage occurring to the gastrointestinal tract, or is it just like an irritation that's happening in that area? So just be able to distinguish between those categories of gastritis and what causes them. So now this takes us into looking at pathologies related to the lower gastrointestinal system. So again, when you're kind of looking at signs and symptoms and you're looking at locations of where, some of the symptoms are taking place, this is where, again, use that foundational talk that we did in class on the anatomy to kind of help guide you with this when you're trying to understand what is going on with some of the different conditions. So that'll take us into looking at now so we did all the conditions that primarily affect that upper GI tract. Now we'll look at some of the lower conditions. So first we have our inflammatory bowel diseases, and the two we're going to look at are Crohn's disease and ulcerative colitis. So both of them kind of have the same transition as far as the pathology, as far as what actually happens. So it's ulceration, fibrosis, necrosis of the different areas. Crohn's disease primarily affecting the small intestine, whereas ulcerative colitis is affecting the colon. They both have they're both genetic autoimmune disorders, and many times a lot of the symptoms begin in adolescence and early adulthood. So these are two conditions, again, and depending upon how they progress will kind of dictate, what type of disability that the individual will have as it relates to gastrointestinal symptoms. One of the big things to really make sure, particularly if you're dealing with somebody who's very active with a condition like this, is very important for them to monitor their hydration because of the condition and how it'll affect their ability to absorb fluids. So another condition that affects the lower gastrointestinal symptom is something called irritable bowel syndrome, or IBS. Now, with IBS, in contrast to the inflammatory bowel disorders, there's actually no inflammation present. It's actually what they call a motility disorder, or it's more of a functional disorder of the large intestine, and what you end up getting are these abnormal, almost spasmodic contractions in the lower gastrointestinal system. You can kind of see that depicted on the screen. And this could present in one of two ways, or a person could actually get both potentially. Is you could get the person who gets irritable bowel syndrome with diarrhea, or you can get a person who's just on the opposite side of that. You can get someone who's irritable bowel syndrome with constipation. And many times they attribute, again, psycho-emotional stress and diet to the connection with irritable bowel syndrome. So a lot of the treatment for this is going to involve finding out what type of presentation of IBS the person has. And of course, you can have somebody who has both constipation and diarrhea, just at different times, depending upon how it's affecting them. Okay, appendicitis is an inflammation of the appendix. So the appendix, if you look at the picture, you can see it looks like a little kind of tag or tail hanging off the lower gastrointestinal system down there. You can see it in the red circle. And what happens is you get an inflammation of that structure due to either infection or some other type of physical irritant. So you can see in the picture here of the upper and lower gastrointestinal tract, and you can see where the appendix is in the lower right quadrant. So one of the key signs and symptoms as it relates to appendicitis is something called pain at McBurney's point. So in looking at your signs and symptoms and developing your chart through your chart and case study assignment, look at where the McBurney's point actually is, so that you can differentiate that. But that's one of your key things that you tend to see with that. The pain tends to migrate to that particular area in somebody that has an appendicitis. And you have diverticulosis and diverticulitis. Now, to differentiate between the two, so diverticulosis is when you have little herniations of the mucosa in the large intestine. So you can see in the picture, you see the little outpouchings in the intestine. If somebody just has that, that's called diverticulosis. And many times people have them and they never have problems with them. So that's what it means. Usually they're asymptomatic. They don't cause problems. If you get feces caught in them and that herniated section and it becomes inflamed, that's when you have diverticulitis, and that's actually what the picture is then further illustrating. So you can see the diverticuli, and they're depicting the feces getting actually trapped in there and that little herniation getting obstructed, and that's when then the person will begin to develop symptoms. Again, the severity just based upon how aggressive the inflammation actually occurs when it happens. So again, when you're looking at this, you will see different common locations as far as the symptoms, which again is kind of a key thing with a lot of these different conditions. Different conditions will have more focal areas of pain and discomfort. Others will be a little bit more diffuse. So again, make sure that you're kind of highlighting that as you're going through some of these different conditions.